I give the floor to the distinguished representative of Integrated Health Outreach. You have the floor.
Distinguished guests, ladies and gentlemen, my name is Nicola Bird. I am the Executive Director of Integrated Health Outreach, and I bring greetings on behalf of my organization and the SIDS4 CSO Coalition members and other civil society stakeholders, and we extend our condolences to the people of Papua New Guinea as well. Civil society plays a pivotal role in amplifying most affected by the development challenges that we face. The aspirations of over 150 CSOs from across the Caribbean, the Pacific and the Atlantic, Indian Ocean and South China Sea, who participated in consultations hosted by the SIDS4 CSO Coalition between February to May of 2024, are represented as they immediately answer the call to support the actions of their countries and the collective SIDS regions. The SIDS4 CSO Coalition is a testament to what we can do when commitments and collaboration fuse with supportive partnerships. We call for our member states to work collectively to ensure that the discussions do not remain at this conference but turn into tangible actions. Civil society has been and will be ready to partner on the Antigua and Barbuda agenda for SIDS. Therefore, on behalf of the SIDS4 CSO Coalition, we call for the following. Vulnerable and marginalized groups, including women and girls, persons with disabilities, the elderly, people in rural areas and Indigenous communities remain most at risk for the impact of economic shocks within SIDS. We therefore call on SIDS member states, civil society and other stakeholders to collaborate on initiatives to, 1, create economic opportunities that are equally accessible and beneficial to women, girls, youth, young men and persons with disabilities, and the LGBTQ community, fostering an inclusive environment. Create avenues for women's economic empowerment through dedicated opportunities for women from marginalized brackets to take advantage of climate change accessible finance, skills training, education, small business financing, and fostering larger markets for informal industries. We call for the inclusion of data resources and collection mechanisms to support SIDS to address the absence of up-to-date poverty and inequality data in Caribbean SIDS and commit to a regular and comprehensive data collection on poverty and key socioeconomic indicators. We call on SIDS member states, civil society, and other stakeholders to collaborate on initiatives to strengthen national human rights machineries, adopt comprehensive anti-violence and anti-discrimination laws and policies, and other mechanisms to respond to violence and discrimination, strengthen community-based healthcare and education, remove barriers to full spectrum of reproductive health service, and improve access to climate change mitigation financing for SIDS and invest in climate-resilient infrastructure that is accessible and provides safety and resilience to communities. We seek and call on SIDS member states, civil society, and other stakeholders to collaborate to strengthen female representation in national assemblies and in national executives, including through concrete measures to increase the number of female candidates, to create, strengthen, and expand frameworks which provide for protection of communities' rights to ancestral lands, and to foster the growth and inclusion of civil society at the regional and international level, to complement the actions of public authorities to afford residents representation and to act for the betterment of the community. Thank you very much for this opportunity.
I thank the distinguished representative of Integrated Health Outreach. I give the floor